Hello, friends. Welcome to Creative Medicine. In this lecture, we will learn about
End tidal carbon dioxide is decreased in End tidal carbon dioxide is decreased in pulmonary embolism, cardiac arrest, in displacement of the endotracheal tube. End tidal carbon dioxide is decreased. End tidal carbon dioxide suddenly becomes zero, suggests that there is cardiac arrest. End tidal carbon dioxide is decreased in pulmonary edema, cardiac arrest, and displacement of endotracheal tube. End tidal carbon dioxide suddenly becoming zero will state that there is cardiac arrest. If end tidal carbon dioxide or the capnogram becomes flat, then that means there is either accidental extubation is seen, or there is disconnection of anesthetic tubing is seen, or there is ventilation failure is seen. Whereas in bronchospasm you can see that there is slightly increased end CO2 and tidal carbon dioxide or EtCO2 is seen.
thank you and thank you for watching.